Hello, everyone. My name is Annie Reyes, and we're pleased that you could join us for this lecture in Volume 4 of our 12-week No Neuropsychology Didactic series that brings you lectures from experts in the field covering different topics each week. Next slide, please. This series was created by trainees and early career neuropsychologists to provide free, high-quality didactic series. Next slide. We'd like to thank our sponsors for their financial support for this series. Next slide. Before we start here, the disclaimers for the series. This training is not meant to replace the formal education in neuropsychology, and the views of the speakers are their own. Next slide. The format of today's webinar is that we'll have a Q&A panel. We have some questions that were submitted ahead of time, so we'll be starting with those. And then we'd like for you to include your questions, submit your questions via the Q&A box on the lower left on your screen. And the recording of today's lecture we provided on our website later this week. So again, we'll be starting with the Q&A of questions that were submitted ahead of time, and then we'll be taking questions live via the Q&A chat. Now it is my pleasure and honor to introduce our panel for today's lecture on the path to pediatric clinical neuropsychology with Dr. Susan Lee, Dr. Clemente Vega, and Dr. Friendship Barrios. Dr. Susan Lee is a board-certified pediatric neuropsychologist at Children's Healthcare of Atlanta. She earned her bachelor's degree in psychology from Emory University and her doctorate at the Georgia State in the Joint Clinical Psychology and Neuropsychology and Behavior Neuroscience program. She completed a predoctoral internship at Kennedy Krieger Institute and Johns Hopkins School of Medicine with primary rotations in neuropsychology and pediatric psychology. Dr. Lee then returned to Atlanta to complete a 2-year fellowship in pediatric neuropsychology at Children's Healthcare of Atlanta and Emory University School of Medicine. She's currently the Associate Director of the Emory University Psychology Internship Neuropsychology track. And Dr. Lee's clinical and research interests pertain to neurodevelopmental and functional outcomes following extreme prematurity or perinatal brain injury, traumatic and acquired brain injury, transition to adulthood, and cognitive remediation of adaptive and executive functioning in children and adolescents with neurological conditions. Next, we have Dr. Clemente Vega. Dr. Vega is a board-certified clinical neuropsychologist and a certified subspecialist in pediatric neuropsychology. He is employed in the Epilepsy Center at Boston Children's Hospital with a clinical and academic efforts that focus on pediatric epilepsy syndrome, neurosurgical outcomes, and cross-cultural application of neuropsychological assessment. He's also an instructor of psychology in the Department of Psychiatry at the Harvard Medical Center. Dr. Vega also maintains an independent practice in criminal and civil forensic neuropsychology, as well as a consultant for public schools and the Boston Red Sox. Last but not least is Dr. Barrios Introduction, who's an associate professor at the University of Colorado School of Medicine, where she has been working as a pediatric neuropsychologist at the Children's Hospital Colorado for the past 8 years. She is board certified in clinical neuropsychology with a subspecialty in pediatric clinical neuropsychology. Recognizing the need for training opportunities that focus on issues specific to bilingualism and multiculturalism, she designed a training program at the postdoctoral level beginning in 2018. She has then been the Director of Multicultural and Bilingual Training, where she's working to expand diverse training opportunities at the extern and internship level, including research. While Dr. Barrios has experience working with children who present with many different backgrounds and clinical populations, she has developed particular expertise for working with children with epilepsy who are undergoing evaluation prior to following surgery. She has developed a new onset epilepsy clinic at Children's Hospital Colorado, which has increased access to care, including neuropsychological screening for children newly diagnosed with epilepsy. We're very honored to have our panel today. And we're going to go ahead and start with one of our main questions, which is, can you just tell us a brief overview of your background and career path? And I think what we're going to do is going to start with Dr. Lee and just go on in order as we have on the screen.
Okay. Well, thank you for the introduction. I think that gave kind of a nice overview of where I've gone to school and done a lot of my training. Like I think a lot of people as an undergrad, I was sort of toying with the idea of whether to go to medical school or if I was going to go into something else. And after working in some other labs, like a cognitive psychology lab, I was doing some mood and emotional research and chronic medical conditions through the psychiatry department. I sort of decided not to do the medical route and had been majoring in psychology and took a class that was an introduction to neuropsychology and neurodevelopmental disorders. And so from there, I decided I wanted to get more clinical experience and started working at the Emory Autism Center and got a lot of clinical applied work in that area for about 3 years, and then decided to apply to graduate school. And in doing so, I realized that there were more programs that had neuropsychology specific tracks than I was aware of, and it seemed to fit perfectly with my blend or kind of my interest in both medicine and psychology and development. And so I ended up staying right here in Atlanta. I went to Georgia State. Clearly Atlanta has got its grips on me because I haven't gone away for very long. And during my graduate program, I started working more in medical populations or with medical populations around Atlanta, both children and adults, and realized that was the route that I wanted to go, and kind of, really dove deeper into those in my internship in Baltimore at Kennedy Krieger Institute, and then came back here where I am now, and finished my fellowship with Emory and Children's and have not left. So
Thank you. And Dr. Vega?
Hi. So I guess this could be really long. I'm going to try to make it as short as possible. I really started psychology with a very strong interest in forensics. When I was an undergrad, that's sort of what I wanted to do. I wanted to study folks more in the abnormal criminal side of psychology. I took a biological basis of behavior class as an undergrad and really fell in love with the more neuroanatomical components of the field. And from that point, I essentially mapped out the rest of my academic training with neuropsychology. I went to graduate school in Miami at a professional school that's called the Carlos Albizu University. And from there, my fellowship was at Yale, and I did my internship at Miami Children's Hospital. I actually started in the adult world and was doing a lot of dementia evaluations in Miami. South Florida, especially, there was a lot of need for Spanish speakers that could do neuropsychology or at least the assessment component of neuropsychology. But at some point, life took me in a different direction. I started doing practicum at Children's Hospital in Miami, and from that point on, stuck with pediatrics, and from fellowship into my current position, it's my first job out of training and my only job that I've ever held. So.
Yeah, and we could talk a little bit about this later on, because I hear a lot of trainees who end up starting with adults and then do a rotation in peds, and that's kind of when they fall in love. And with that it comes like questions about, have I had enough training to be competitive for internship and so on. But we have specific questions, so I'm going to go ahead and ask Dr. Barrios to go ahead and kind of introduce herself and provide a bit of her background.
Yeah, thank you everyone for joining us today, and thank you, Annie, for asking me to be a part of this panel. I'm very excited to hear that there's a group of you guys that are interested in pediatrics. I think, I know Clemente pretty well, and there's a pretty small group of us who seem to meet with these interests. So I'm glad to hear that will be expanding, or is expanding now. So I do have a similar background to Clemente. I didn't know you were interested in forensics, but so was I. I actually minored in criminology in undergrad. And psychology was my third major. I think I wasn't like many people who always knew they wanted to do neuropsychology. I didn't even know what neuropsychology was when I entered graduate program. And I actually started with a mental health counseling program, so a terminal master's program. And I realized I wanted to go on and do my doctoral degree. And that's where I kind of started learning about neuropsychology and biopsych programming. And that's really where I started to think about a career path in neuropsychology. Through my master's program, I had been exposed to working with children. And so for me, it was really important to not only get the background with child development, which my program did offer track in, as well as neuropsychology. So we can talk more about that as well. But I did want to kind of emphasize that just because you didn't think about this early on doesn't mean that you can't do this later on. Like I said, I didn't really even figure it out until I was already in the doctoral program that I wanted to do neuropsychology. And I was grateful that Carlos Albizu in Miami did have a neuropsychology track. But even still, our main professor in that area was more adult focused. And so it really took a lot of effort on my part to really merge my loves of child development and working with children with that neuropsychology track as well, and having to sometimes do a little bit more coursework to get a little bit more of that broad-based training in each of these areas. So now I did my internship also at Miami Children's Hospital, similar to Clemente. But then I went on to do my postdoctoral fellowship at Dartmouth in New Hampshire, which gave me a more broad-based training in different aspects or different medical diagnoses at that point. And then with that experience, I was able to get a position out here in Colorado, which I've now been here about 9 years, and thankfully been able to work with the large Mexican population that we have here. So I know that there's some questions about working with culturally diverse populations, so I will leave more information about that for those questions to follow.
Thank you. And I think this is a kind of a perfect way to start with some of the questions that pertain more in terms of training. You know, I myself have some friends that are in pediatrics, and it seems like the path is very different. You even need more hours for internship. You need very specialized training. So one of the questions was, are there any particular types of pediatric neuro experiences that trainees should be going for in order to become competitive for internship? And they were specific versus like epilepsy versus neurodevelopmental evolves. Is there anything that they should be prioritizing during their doctoral practicum training? And then whoever wants to go ahead first.
I'm happy to jump in because we have both internship and postdoctoral programs here at Children's. I think a lot of the things that we're looking for are actually broad-based experiences, even if that means in different contexts. So they don't have to all be hospital-based, even if you are applying to a hospital-based training program. I think we do like to see, especially at the postdoctoral level, but also at the intern level, some experience with medical populations, because that can be a little bit of a learning curve if you've not had experiences with different medical diagnoses, and how we may think about things a little bit differently than children who do not present with that medical background.
I would, add to that. I would agree with everything you said, but we also have an internship program and a fellowship program here, and we look for a similar breadth of training. Our internship program is actually a lifespan program, so we don't necessarily expect that any one applicant comes in that has a, all of their hours and every type of setting or diagnosis or evaluation approach, whether it be screening, pre-surgical, full evaluation in both age groups. And sometimes it's not possible. We understand that not all doctoral programs have practicum opportunities around them in each one of those areas. So it can be great if you can use the experiences that you've had and demonstrate how you would think about it maybe in a different setting, or, talk about it in terms of things that you've learned in coursework that you've been able to do, or didactics that you've chosen or elected to attend, or webinars that you've signed up for if it's not something available to you.
I would agree with everything everyone has said so far. I don't think there's much I can add. Very similar in terms of what we are interested in when folks are applying to the fellowship. We don't have an internship. At least I'm not part of the internship application process in the hospital. One thing I will add is the folks that come in with, if they're interested in pediatrics, if they come in with experience working with neurodevelopment, especially the autism spectrum specialty, there is a relative strength that folks with that training bring into the pediatric hospital setting that has to do with just understanding the administration of the tools, but also knowing how to maximize the application of the test. In other words, it's really hard to test kids who are on the spectrum and to get through an entire battery of tests with them. And if somebody is really experienced in doing that, they can probably transfer that skill into the kinds of populations that we're working with in the hospital, because they can be very challenging oftentimes to get them through an entire battery.
Great, so it sounds like there is some flexibility, but it sounds like more breadth of training, perhaps with medical children with medical diagnosis, also too as well, if you have experience with autism spectrum disorder, that also seems to be a strength. So with that being said, I think as I mentioned earlier, some trainees may find out that they actually want to pursue pediatric neuropsychology, maybe halfway through their training in their doctoral program. Is there a time when you should not consider pediatric neuropsychology internship or fellowships if you don't have significant amount of peds neuro experience at the practicum level? I guess that question was more in terms of like how many years of pediatric neuropsychology should you have to consider an internship that has a peds rotation or focused?
I would say that you're not going to be ruled out if you have experiences with adults, depending on the setting, that you're allowed to get some experience with testing and with different diagnoses. But I think at the internship level, we look for at least one, I would say ideally 2 or more pediatric neuropsych placements, so through practicums, to make your application competitive, and that we want to see that you truly have an interest in working with children and that you're not just applying to our site because it's another neuropsych placement and what the heck, why not? So we want to see a pattern not only in practicum training sites, but also in other presentations or projects, posters, things that you might be involved with that reflect an interest in working with pediatrics. So if you do have some adult experiences, I think that's okay. I actually was going to share that when I was doing practicum, there was a pediatric neuropsych placement that I really wanted that wasn't available the year I needed it. And so I did an adult neuropsych rotation. And I really was grateful for that experience, to getting some more experience with adults, even though I knew I wanted to head in the direction of pediatrics, but at least I was getting some of the neuropsych training that then I could then apply to working with children later on.
Yeah, I would agree with everything that you've said. I also like to say that it's not, it's never too late to show an interest in pediatrics, and that you can still grow those experiences, even if it comes towards the end of your graduate training. Again, our site, again, being a little unique because we do have a rotation in adults and pediatrics. So we do like to see both. And it's a little bit harder to, to say that you have 3 years of pediatrics and then come in and feel comfortable doing our adult rotation. But ideally, yeah, one year or so, and having, an experience that may be on the, maybe you have a smaller amount of time that you've spent in a medical pediatric population or setting, being able to demonstrate in some way that you could flexibly adapt the things that you've learned there or on your adult rotations to work in the pediatric rotation would be helpful. I mean, we've looked at plenty of applications, and just based on experience and letters or research that they've been involved in, we feel confident that even though they've had less pediatric clinical training, we feel comfortable that they would be able to apply the skills that they have learned in our setting. I think fellowship would be a little bit harder. I don't know if we're jumping ahead to that, but I think when you get to the fellowship level, not having a significant amount of pediatric experience, I would, think very, very carefully about whether or not you're prepared for that.
Okay, so it sounds like for internship, perhaps there's a bit more flexibility if you have some gap in your training. However, for fellowships, a trainee should be thinking about whether they do have an internship that has a pediatric focus, that may make them less competitive for postdoc. Is that what I'm hearing, Dr. Lee? Yeah.
I think with the internship, it's going to vary some by site. The internship that I went to was all pediatrics, and I did, 6 months with pediatric neuropsychology and 6 months with pediatric psychology. So I wanted to make sure that I had those experiences, and that was a good fit for me. Whereas that might be a little bit different than applying to our Emory internship.
Dr. Rebecca, was there anything you would like to add, or should I go ahead and go the next question?
I don't think I have anything specific to add. I don't want, we have a lot of questions, so I don't want to go really long. I just want to highlight something that was already said about the adult experience does bring some good quality to it, even in pediatrics. There's a lot more assessment in some of the adult rotations that people do. And there's a lot of emphasis on neuroanatomy and localization of dysfunction that I think, at least for someone who does a lot of work in epilepsy, I've noticed that some of the trainees, they come really prepared for fellowship with that background.
Perfect. And I guess the next question is, in terms of being a competitive applicant, what sorts of things, what is any tips on being a competitive intern applicant as well as a fellow applicant?
Clemente, maybe you want to go first so that I don't take all your answers.
I don't mind. I agree with what you're saying. So what makes competitive applicants? I would say experience, at least in pediatrics for fellowship, the variability in experience, a lot of diversity in experience. Sometimes folks who are doing pediatric training are doing a lot of work in the school system because of the nature of their program. And so that really limits the type of rotations with medical populations. The focus on populations that match the fellowship that someone is interested in is what I would say should be part of the priority. And in a hospital setting in pediatrics, for example, epilepsy is a pretty significant component of what neuropsychologists are doing. At least that's how it was when I was training. And in the hospital where I am now, there's a lot more volume within epilepsy brain surgery than other subspecialties. And the other benefit of a population like that is that it gives a variety of conditions inside of one. So epilepsy is related to brain tumors and also with stroke and also with autoimmune disorders. So in genetics, some genetic conditions. So it might be one rotation that provides a bit of experience with multiple populations, as opposed to maybe school system rotations that are mostly learning disabilities, ADHD, or autism. So maybe experiences where there's more variability in population would be my summary.
Okay. Anything else to add?
I would just add, I think Dr. Lee may have mentioned this before, but at the internship level, it's really important for the neuropsych applicant to also have good therapy experiences because we work together through psychiatry for ranking our interns, and because they have rotations and doing therapy and working with our clinical psychologists in addition to the neuropsychologists, you're not going to get a good score from us reviewing your application if you don't have any experiences in those other areas. So being a well-rounded applicant is very important as we're reviewing your application and considering bringing you in for interview.
That's exactly what I was going to add. Yeah, just kind of to plug in that piece too, that there is a treatment component, intervention component to internship too, that you need to be prepared for.
I'm going to go ahead and there is a live question, which before we move on to boards, perhaps we could address this one. So this one is from someone who is a post-bac researcher, and they're applying to PhD programs. They're already interested in pediatric neuropsychology, and they're wondering how can they find programs to apply for that will best set them up to a path to becoming a pediatric neuropsychologist. So I'm not sure there are programs that you know of that have a child emphasis in neuropsychology. I know that with the Houston Conference guidelines, it seems very broad in terms of what that neuropsychology emphasis or exposure looks like. But you are aware maybe of programs that may have kind of more of a child emphasis within neuropsychology?
I was just going to say I come from a PsyD program, so maybe a little bit different when you're looking at PhD programs, but the PsyD programs will definitely have kind of different coursework that you can do, as I referenced earlier, like a child development or child psychology or neuropsychology track that kind of gives you the core courses that you would want, but then also look for a program that has a neuropsychology track as well, to make sure you have some of those foundational skills, knowing that this is an area. And then because we have so many more programs in schools now, I've seen some applicants that are having to travel for their practica. So it may be important to also look at what training programs for practica are in your area, so that if you know you want to work with medical populations in a medical center, academic medical center, that you would have some opportunities. So maybe ask about some of those as you're applying to the program, but also what faculty are at the program, what type of research are they doing, what experiences that they have, so that you know who you could be potentially working with and some potential mentors as well.
Yeah, I agree. I think reaching out and talking to, or if you've got maybe a list of, or even a short list of programs that you might be interested in, and you see that they have children's hospitals or facilities in the area where you may be able to work in, reaching out to faculty that are currently there and seeing who might be accepting a student into their lab if you're looking at a PhD research program, talking to current students that are there, asking about the practicum placements that they have. I think from most of the programs that I know that have a specific clinical neuropsychology track, it's a very general track, and you're expected to take coursework, both adult, kind of general clinical neuropsych assessment, and then you can take some more focused pediatric courses, but a lot of your pediatric neuropsychology specific experience comes from your practicum placement or the research lab or projects that you're involved in. So it adds a little flexibility with that.
There's also, we brought up about schools, and there was a question regarding that oftentimes, people who are in pediatric neuropsychology get the question in terms of how to get on the path to neuropsychology when coming from a school psychology background or counseling psychology.
So I would say one way to do that is with the practicum placements. Folks who may be in school neuropsychology, in the programs I'm familiar with, there's still opportunity to work with medical populations in the hospitals of the area where their program is located. So that would be, I would say, the one of the options is looking for training sites that have medical populations. Counseling may be a little bit more of a challenge because there is likely to be less exposure to assessment in neuropsychology, whether it's the internship or the fellowship level. There is a requirement for a lot of assessment. So that might be more of a challenge, and looking to expand that. And maybe if the person's really interested in that, sitting out a year to get more experience with that to ensure that they are more competitive applicant may be necessary.
And I guess for students who are in the process of applying to programs, are there any pros and cons in going the clinical versus school versus counseling psychology route? It sounds that perhaps clinical and school may be more beneficial in terms of like matching for internship and so on.
Clinical and school over counseling probably more beneficial, but I think there's a lot of opportunities and a lot of training that's built into a clinical psychology program that may not be in a school psychology program. So if you want to go the clinical route, you want to work in a facility where you're providing diagnoses and recommendations in a medical setting, or I think the clinical route is more set up to do that. You would have to do less work to create those opportunities.
Okay.
Doesn't mean it can't happen.
Yeah, if I may, just one liner on that. I always recommend to students to, when they have several options, if they're undecided, go with the option that gives you the most variety to start with, and then you can start narrowing your path as you go along. So counseling programs are going to be a little bit more narrow. School programs are going to be more narrow. Clinical psych programs will give you the option to go the school route or the counseling route, or another route if you halfway through decide, this is something that what I thought I wanted to do is not what I want to do, which I think some of us, that's what happened. We thought we were going to do something. We ended up in a different place, but at least you have more doors that are available for you to go through or walk through if you start with a more kind of wider perspective.
Yeah, I think that will be great information, especially now the trainees are getting ready to submit those applications this fall. I think keeping in mind that the clinical perhaps degree gives a little bit more variety in terms of training. Okay, so the next question, it's actually a little bit more broad, and I'm in the other side of pediatrics. I'm more general, and had very little experience with peds. But one of the questions is, any recommendations for non-peds trainees to gain experience with peds population and lifespan issues? I think sometimes we forget that the adults that we're seeing in the clinic were children once upon a time. And I think there is this kind of lack of even kind of training between the two. And oftentimes we are seeing patients who, had neurodevelopmental disorders growing up. So any recommendations on how to gain that exposure, even if you're done with your training as a non-peds person?
I think any kind of coursework that you could do that includes child development, knowledge of child development, is going to help you in that type of setting, because that's really the knowledge that we're applying when we see older, young adults even into older adults, is understanding the trajectory for their brain development in the context of possible medical disorders, or their neurodevelopmental disorders, or other factors that may influence their development that you may need to take into consideration when you're seeing them in adult, whatever the situation. And then I'm not sure if they would, be training opportunities through Practica if you're kind of doing more adult, but possibly lifespan. I don't know as much about that. Maybe that's something Dr. Lee could speak to a little bit more. But that would be the first place to start, I would recommend.
Yeah, we've had this question come up quite a bit actually on our internship. Some of the folks who aren't going to be rotating with us in the peds and our peds rotation have wondered if there was an opportunity for them to just be able to observe or see a couple of cases. Some of that just depends on the timing of the program or the, where you're at in your training. But we would invite people to come to didactic. So like the suggestion of getting more coursework, that would be a great place to go. To do seminars, or even our neuroanatomy case conference or brain dissections in the pediatric world could really give a nice exposure to some of the disorders that we see a lot. Sometimes you guys might see as adult providers as well. Being able to see them or kind of listen to case discussions about them would be a great place to start.
Okay, and no neuropsychology, I was mentioning earlier, all of us on the committee right now are all adults in general. So we're really trying our best to make sure we're incorporating pediatric topics. So that's one, you know, I totally agree. I've been actually listening into the Pete's talk and have been learning so much. So everyone who's watching who maybe is not non-Pete's, definitely check out our previous lectures. Okay, so there are a few questions. They're kind of divided into boards, kind of how do you develop a clinic? And then there's some specific questions regarding kind of the day-to-day work that you all three do. So I'm gonna go ahead and start with the cultural piece. So there was a question if there's a need for more racially, ethnically diverse pediatric neuropsychologists currently in the field.
I think the answer is pretty obvious for many different reasons. And just to start with, I think it's important to not only have representation from different cultures, different races, different ethnicities in faculty in medical centers across the country. Also for our trainees to have mentors that they feel like they can look up to from similar backgrounds, I think would help with the training process and feeling like you have mentorship available, even if you do feel like you come from an underrepresented group. So I'll just start with that and let others share as well.
Sorry, I don't want to jump in and just assume I always go second. But yeah, I wholeheartedly agree. I think representation from a diverse group is really important. And I think the answer is an obvious yes, like it is in many other places when this question comes up. Yeah. So.
Okay. So go ahead with the next question, which is in terms of, what cultural diversity issues arise in your work as a pediatric neuropsychologist? And if so, how do you address them?
I can start with this one. I wasn't sure when I was looking at this question in the email whether it meant clinical issues or other issues. So I'll start with what I think are easier, the easiest route, which is clinical question. In PEDS, one of the most frequent question I get with a non-English speaking patient is whether the current concern, behavior or cognitive or learning, is related to the culture, the language, or an underlying disorder. So having to differentiate between how much of the kid's particular issue is related to any of these variables is a frequent clinical challenge, not a terrible challenge, just an interesting, very motivating challenge. And oftentimes I say when there are multiple questions to try to explain the same single thing, the answer is probably a little bit of all of the questions come into play. So I would say that's part of it. The other often issue that we encounter a lot is the difficulty with the family understanding the system, the school system, the medical system, whatever system we're working with, not knowing everything about it in the same way that someone who maybe has been raised in this particular culture their entire life and sort of understands how the system works. So helping the family navigate the system, I think, is another one of these challenges.
I can speak a little bit to the kind of systemic challenges and just working in an academic medical center relating to cultural and diversity issues. And I can only speak to where I currently work because this is where I've been since postdoc, but at our institution, it really starts with understanding the needs of the population. And so how we've tried to address, because we have a large Mexican Hispanic population here in Colorado, is by having several neuropsychologists that are not only bilingual in Spanish and English, but also have experience in working with different cultural and diversity issues as we do the neuropsychological evaluation. And it steps beyond some of the clinical issues that Dr. Vega mentioned to also thinking about things like even starting with referrals and the triage process, and how are they getting scheduled with the right providers, because we often have, a little less clear where maybe the parent speaks some English, but their main language is Spanish. Who should they go with? Maybe the child is also bilingual. Who should see them? And so we have those issues come up. And so it's not only about working with bilingual neuropsychologists, but also educating the other faculty who may not have had as many opportunities or experience in working with bilingual and multicultural families. And this extends also beyond into our trainee levels as well, where we're instilling some of these basic practice guidelines of understanding kind of the limitations based on your experiences and moving forward with working with patients of these different backgrounds. And then beyond that, it's also about scheduling. Now that we're doing more telehealth, what is the access to care for some of these families, having to think about some of these issues. And then, as Dr. Vega also mentioned, accessibility, and to be able to follow up with some of the recommendations that we're providing for these families, and do they fully understand, when we're giving them feedback, and what are some of the considerations when doing this type of work. That makes sense.
Yeah, so it sounds like there is a very big kind of family component that transcends a whole cultural piece as well. And oftentimes, I'm assuming that there is bilingual, the children may be bilingual, but maybe their parents may be monolingual and non-English speakers. So it sounds like also learning how to navigate that system as well is recommended as part of the training, or is it something that you'll get once you get to internship? Go ahead.
No, sorry. I was just gonna try to answer that. I think a lot of that comes with experience, whether, hopefully you get some experience early on in your externships and internships, but also at the postdoctoral level, it's something that we're including all trainees on, how to kind of assess your family and the child's background and understand what their particular needs are. And then, consulting if needed, or even, passing that patient along, saying, I don't have the right experience to conduct this type of evaluation. Who in my area could potentially serve this patient better?
And I think that was a really good lead to the next questions was put on the chat. And it's regarding recommendations and considerations that you have for tele consultation in pediatric neuropsychology, as you mentioned, in terms of if you don't have the experience or background to work with certain subpopulations. Yeah, so any recommendations for tele consultation?
I'll just keep talking if nobody else is going to jump in. So I think this is a very interesting topic, and a lot that, some papers have been coming out on presentations recently just because of COVID and the push to do telehealth these days. And I think it's an interesting thought. I think our institution has kind of gone back and forth between how much do you do over telehealth versus in person. And so definitely the benefits are that we could potentially have access to people who can't drive the distance to come to our hospital, because we serve a wide area out here in the western states, but also some limitations, right? I've had families say, I didn't have a job because of COVID and I couldn't afford Wi-Fi. And so there's that aspect to it as well. I've had several of my Hispanic families as well, just say, I don't deal with computers. I don't understand how they work. I'd rather do all in person. So there's that piece, but then there's also the piece of understanding how well we're able to conduct testing over telehealth, which I think is a controversial issue as well, especially when we're dealing with younger children or children with other kind of cognitive, language, neurodevelopmental issues. So all of those things are worth considering. And I also depends on why you're seeing them, the reason for referral. So all of those things need to be taken into consideration.
Thank you. And I think, as you mentioned, COVID, and there's a question which when I was applying for internship, I also had to deal with this. And in terms of hours and the fact that, some practicum experiences are leading to students actually losing hours. And if this our sites taking this into account, particularly for peds applicants who seem like they require a lot more hours than else in adults, Gerald?
I'd say this, yeah, this is absolutely, I mean, I can only speak from, our site specifically, but it's absolutely being taken into account. I think, focusing less on the number of hours and more on the experiences that you've have had during the time when, things were closed down and you weren't able to do anything clinically face to face, then what did you do with that time? Were you still attending seminars or webinars? Was there research that you were involved in? We had a lot of students that, we were having additional seminars during the week to try and provide, to do some case discussions so that they still had some exposure during the, to that, not exposure to COVID, that sounds weird, but during the COVID time, making sure that they still had training opportunities, because of course we understand there was a lot of anxiety about how that was going to impact readiness for internship. But I absolutely think that it's being taken into account, and everybody understands that it's been a very, very different couple of years for everyone.
And I'll just quickly add, since my cohort was the cohort that actually started with during the time of COVID, we actually, many of us wrote in our cover letters. We explained what we did during that time and how we also asked our training directors in our programs to also, in the letters that they submit on the APEC website, to kind of explain how how COVID has affected our practicum sites. And it just seemed like neither of the sites that I interviewed had an issue with that. So definitely making it very explicit, as Dr. Lee mentioned. Okay, I want to leave enough time because we have probably one of the bigger questions, since the three of you are board certified. And it's in terms of, the PEDS board certification process, and if there are any unique training goals or experiences that you should prioritize in preparation for this down the road.
I can start. I would say I always try to calm everyone's anxiety about the board process by starting with, this is something you've been studying for your entire training and all of your career. So that next exam or written exam or next part of the process is really refreshing or sharpening the knowledge that you've been acquiring for a long time. And the same applies for the pediatric subspecialty component. A lot of the information are things that people were exposed to already in graduate school and in training. There are unique aspects to pediatric neuropsychology that may be specific to a population different. So maybe more to do with genetic disorders, autism, or maybe looking at developmental outcomes that maybe are different with adults. So emphasizing that in studying may be a good option. And in terms of the training, nothing different than what we've been talking about this whole time. There's still a component to the process that has to do with assessment and knowing about assessment and also the specific populations and what do we expect to see in these clinical populations in terms of the assessment or anything else, right? Their developmental trajectory. So a lot of the same things we've been talking about apply for the boards.
So I'll just add to that the absent postdoctoral programs are the ones that are specifically designed to prepare you for board certification. And for those of you who may not know, you need to have passed the general clinical neuropsychology board before you can even apply for the pediatric subspecialty. So they make us work a little bit harder. So just keep that in mind. And so that's why it's important to get a broad-based training across different medical populations, and then expose yourself as much as possible to some of the adult diagnoses as well, because for the written exam, you really have to know, for the base clinical neuropsych board exam, you have to know peds and adult. Sorry, that's the truth. We all had to do that. So keep that in mind. I think, a strategy a lot of our trainees are given here when they come through is they'll attend like the adult neuropsychology seminar to be able to get some exposure to that. But I agree with everything that Clemente said. By the time you're kind of at that point of doing your pediatric subspecialty, you should have been working in this field already. And so really just submitting your work. And this is kind of what you do day in and day out. So should not be as anxiety provoking as it is.
I have one piece of advice to add about the general clinical neuropsychology exam. Like everything that you guys have said, and I agree, and all that we've been talking about, and having this kind of broad-based, neuroanatomy, base of exposure of knowledge would be helpful for that test. But one thing that I found to be helpful was pairing up with a colleague who works with adults when we were studying for the exam, because it was helpful to be able to put some of the knowledge that I had from books or maybe from one practicum rotation into a very kind of a functional, example of a case that was really helpful. So that's one thing to think about, because it's definitely a higher percentage of adult and gero information on that exam than what us peds folks.
Okay, thank you. Yeah, and that was really one of the big questions that we had. And the next one, there were a few of them, and it was in terms of starting a pediatric neuropsychology clinic. And I think there was one in terms within already an established academic medical center, and also in terms of private practice, since there seems to be, neuropsychologists who do both. Any tips, any recommendation in terms of developing those types of clinics?
I could speak a little bit to creating a clinic within a hospital environment. I've not worked in a private practice, so maybe that's something one of the others can address. So for me, I did develop the new onset epilepsy clinic at our hospital. And so it was really just identifying the need within this population and talking to others because it's a multidisciplinary clinic, who would be involved in that clinic. So neurology, for example, we also got outsourced resources like through the Epilepsy Foundation involved. So understanding the needs of our population specific in our area, but then also the support, including funding within the department to allow for that. And then also thinking about what are your goals in having a clinic. So for example, this is a multidisciplinary clinic, but we also do screenings. We do testing in this clinic. So the goals for this were really to be able to capture kids with new diagnoses who may not have had yet resources through a 504 and IEP, or understanding what their difficulties may be at this stage in their diagnosis. So understanding what your goals are will help you really understand what your funding and support needs are, but also the collaboration needed amongst a multidisciplinary team.
And Dr. Vega, I know that you have a private practice. Any tips in terms of broad tips or recommendations in terms of starting a private practice?
Learn a different language. I think part of the genesis for the private practice many years ago was the need for someone to do evaluations for Spanish speakers in the area that just in an area in the Northeast where there just wasn't a lot of providers. Outside of that, I always recommend getting a good idea of what the possible referring sources or referral sources are, and doing a little bit of professional marketing. If there are some neurology practices, for example, all of this is regional, and it may depend, right? Opening up solely working in private practice in Boston, it would probably be really challenging as a right out of training, because there's multiple pediatric hospitals and every single one of them has neuropsychologists that work in those places. So it'd be probably difficult to get new referrals, but knowing the potential referral sources like neurology practices, primary care physicians, even school systems in the region, and at least announcing to folks in the area, trying to find a pair. If there's someone who's already established, who only or mostly sees adults, getting a sense from them to see if they could see a pediatric practice functioning in the area, and any other colleagues that may be nearby to get an understanding of the market, if you will, right? There's a little bit more business to starting a private practice that I think we're used to in our training exposure. So we'd have to take a little bit more of that approach to start it.
Thank you. And I know we have just 3 minutes left. So there was one question that was actually included twice, and that's in terms of the reports. And I know I heard from my pediatric colleagues that the reports tend to be pretty lengthy compared to what we do in the adult world. And this question was in terms of increasing writing efficiency when it comes to writing pediatric reports, and if you have any book references that you often refer to.
I'm always trying to make myself more efficient as well. So this is kind of an ongoing learning process. But I do, especially in my more advanced trainees, I am trying to encourage them to shorten, especially the results section, because that's just what seems to go on and on. I've gotten to the point with mine where I just write my impressions, my conclusions and impressions. I've seen some styles where bullet pointing, like main points, main findings, works really well. And then you can elaborate more in recommendations if needed. I don't have any book references for how to do that, but I think that's an ultimate goal. I don't know if I have any more specific recommendations on how to get there, because I'm constantly working on that too.
Yeah, I would agree. I think they tend to be longer, the pediatric reports, because we do need to include a little bit more about neurodevelopment and early kind of childhood experiences. But yeah, the place that we've been able to kind of shorten down our reports is taking some of those test results sections out and really focusing on strengths and weaknesses and what our recommendations are. So I'd agree with that. And we're actually working with our trainees in doing different report styles as well. I think for a book reference, I think Donders does have, I think it's just called like neuropsych report writing, where they, he's definitely a big proponent, or talks a lot about kind of condensing and shortening the reports.
And I think with that, we're going to end. And we also having Dr. Donders give us a talk on writing reports. So I think maybe perhaps ahead of time, we'll have him just kind of mention the difference between the two and whether he himself has any tips. Thank you so much, all three of you, for participating in this panel. I think this is going to be extremely useful for our trainees in different stages of our training. And we definitely appreciate your time and volunteering your time and your expertise. I know we're at the hour. Any last minute tips or just anything you want to end with, or we could just go ahead and end the call. All right. Well, thank you all. And I hope to see everyone next week. We're actually going to have Dr. Francesca Arias, who's going to be talking about delirium during our next webinar. Thank you so much for joining.